All right, we are live right now. Come on in, everybody. Welcome back to another Tennessee Holler Facebook Live. I am Holler founder Justin Canoe. We're at the TN Holler on Twitter and Facebook is where you can find us. You can also find all of these other hollers throughout the state. We have hollers in Memphis, Chattanooga, Cookeville, Tri-Cities, Knoxville, Memphis, Murray County. That's all thanks to your support. We really do appreciate that. So please keep chipping in monthly if you can. It really does help and helps us keep growing and sustaining. Goes a long way. We also are supported by Elisa Parker, a realtor here in Tennessee, and supporting her by, if you're buying or selling, go through her. Suggest to your friends to do that and let them know the Holler sent you. That's a good way to support the Holler too. We appreciate her support. Today we're going to be talking to Eric Atkins, a new friend here in Tennessee. Eric, how are you?
I'm doing pretty good today. How you doing, Justin?
Pretty good. So Eric is a representative from the Tennessee Poor People's Campaign, and want to let you know that you guys can comment along. We see you. I see my buddy Carlos. Eric, Carlos is our resident troll. He likes to come in here and throw us those Fox News talking points, but I want to know that he's welcome, even though we don't agree about a lot. Still want people to check us out and communicate with us, and we can have a conversation always. The main topic today is going to be about the failed, or as Eric put it, the lack of a COVID response here in Tennessee. Just want to start it off by pointing out that Governor Lee has us as the number one overall in COVID cases per 100,000 people. We currently have one of the worst outbreaks. We've had one of the worst outbreaks per person throughout this entire ordeal. So that is nothing to be proud of. You know, we've obviously had a lot of issues with our schools and all of that. So Eric, why don't I start off by asking you generally, what is the Poor People's Campaign, and why are y'all so upset about Governor Lee's lack of a response?
Well, the Poor People's Campaign was began by Dr. King and many civil rights advocates over 50 years ago as a response to what needed to take forth in the country following the successes of the civil rights movement. We did get out of the civil rights movement. You did get the Voting Rights Act, and you did get the Civil Rights Act. But when we looked along the periphery, we saw that a lot of people were still having problems surrounding poverty. And we took a lot of we went to a lot of areas, the backwoods of Mississippi and down Council Alley down in Louisiana, and you found some common trends that even though people were working, you still had a sharecropping society in a lot of places, and so it was just very difficult for the average person to progress from an economic and financial standpoint, and that's why the Poor People's Campaign was launched over 50 years ago. Oddly enough, it began in March, Mississippi on a mule train. It went straight through Memphis.
So my understanding of it is that, you know, the goal is to let people know that it's to cross racial lines, that poverty is not black or white, that poverty is colorblind in a way, and that, you know, people who are poor in this country, which I think the number is something like, you'll correct me, but, you know, 39% or something like that, or at or below the poverty line, or maybe that's Tennessee. You know, that poor black people, poor brown people, poor white people have more in common than they do different. Is that why it's called the Poor People's Campaign?
Right. Poverty doesn't have a face or race or a name or a color or a creed. It is something that directly impacts people. And so from our estimates, we have over 140 million people that we call low income and poor in this country. All you have to do is ride around whatever town you're in right now, and you're going to see a bunch of homeless colonists in areas that you used to didn't place them. A lot of tent cities in areas where you did not used to see them. A lot of people that are sleeping under underpasses now. A lot of people, and we noticed that the governor says get back to work, but we have to have livable wage jobs first to be able to get back to work. Jobs that give you benefits and retirement and those subsidies that are necessary. And so, by our estimates, is 140 million low income and poor people, and that number is climbing every day.
That's an exorbitant number. I'd be remiss if I didn't mention that, the leader, I think, of the current iteration, or I don't want to say leader, but one of the faces of it is Reverend Barber, who we've actually had on the Holler. That's more of the national, and then this is kind of a Tennessee chapter of that. Is that right?
That's right. We are the Tennessee Poor People's Campaign all across the state, and so that's correct. We're linked up with over 40 state coordinating committees across the country. So we are the coordinating committee of this state. I happen to be one of the co-chairs for that, and we are linked up to the national body. Yes, because it is some issues that transcend location, and poverty is one of them. Lack of health care is one of them. We should have been concerned about a lot of the medical impacts in this state when we didn't pass Medicare expansion. 670,000 people could have been added to the healthcare rolls. That was failed to do so. We should have been concerned when 13 rural hospitals closed. We should have been concerned when 20% of the children in this state go to bed hungry, and 20% of them lack food nourishment. And so the food insecurity is another issue. We had great concerns before COVID-19. COVID has only exacerbated some of these problems that we are seeing.
I think that's absolutely true. And, it's certainly something that we hear a lot about. Medicaid expansion was at the top of mind, until other issues kind of took the forefront. Actually, just last week, Republican Representative Bob Ramsey in Maryville was giving a talk to a group in Maryville and talked about how the Koch brothers were the main reason for not expanding Medicaid here in Tennessee. And like you said, that's hundreds of thousands of people that don't have health insurance, $1.5 billion a year that we're losing out on for no reason here in Tennessee. So Eric, I want to ask you, obviously we get a lot of pushback when we talk about this stuff. People.
Well, we have another issue too. Don't forget, at the same time, we have all these people that are having these health disparities. We are sitting on hundreds of millions in TANF funds that we didn't know how to distribute. $730 some odd million that we actually had to go through special session to figure out, just to spend 2/3 of them. So it's still a third of them that we don't know how they're going to spend.
That's right.
How are we sitting on these rainy day funds in the billions, and these funds that are needed for poor and working class people in the hundreds of millions, and we're in a crisis right now? It's just unbelievable.
You're absolutely right. This Republican supermajority loves to talk about how financially responsible this state is, but what they don't mention is that comes from hoarding resources. While we have an F in education funding, we are number one in medical bankruptcies, rural hospitals close all over the place. We also are one of the most federally dependent states in the entire country. We get 37% of our budget from the federal government. So, they brag about how financially stable we are, but really the low taxes comes at a cost. And, a lot of the programs that we don't beef up with the rainy day funds suffer as a result. But what do you say? I'm sure you have conversations with people that don't agree with you about some of this stuff. When the people say to you, it's not the government's fault that there's this much poverty, what's the retort to that?
Well, and they like to talk to us a lot of time about right to work, and we have to come right back to them. Well, it might be right to work, but that's also right to get fired, because we believe in the right to collectively bargain and the right to unionize, and that people should have safety and health standards, and people should have retirement and benefits, and then have salary and wages negotiated. And some of those things are exactly what we are seeing right now. When the governor demanded that we go back to work, and a lot of the people, even though we opened wide up, go back to work, well, a lot of the people wanted livable wage jobs,
right?
Where they can have health and safety standards. And so it was odd to us that they labeled workers as essential. and we're talking about the maids, and we're talking about the street car drivers, and we're talking about the bus drivers, and we're talking about the people that cook and the retail clerks, and also the people that's working in the hospitals now. We told all these people they were essential, did not give them the essentials to survive, like personal protective equipment, like hazard pay, like additional COVID relief sick days. You shouldn't be having to dip into your sick days for what we're experiencing right now in the crisis. You ought to have COVID relief days to draw from. And so it's just unbelievable. They took people that were not thought of as essential and made them essential and did not give them or provide them the essentials to survive all throughout this pandemic.
Yeah, and you hit on an issue that I'm a member of a union. I believe strongly in unions, and we've seen that unions in the middle class go hand in hand. And so they've attacked collective bargaining. They're now trying to enshrine it in our right to work in our Constitution. And, as you said, it's the right to get fired also. And so they've put people in these desperate situations. And that really rears its head in a time like this where people are struggling. You had a bunch of people become unemployed, which meant they lost their health insurance. You've got people who are in schools who are afraid to speak out. They don't really have a union in Tennessee. So their, jobs are on the line every day. And when you make people more and more vulnerable, the power becomes in the hands of leadership, of the bosses. And that's where we are in this state. We've got a lot of people who are poor, a lot of people who are struggling, people afraid to speak out. And as a result, we have the worst outbreak in the country. Poverty is, really bad in Tennessee, in education funding. What would you like to see from Governor Lee? What is the Poor People's Campaign asking for?
Well, the first thing at the top of our list, we're worried about voting rights. So we've been really hammering that issue for the last couple of weeks. But we need to have a COVID-19 strategy, especially for the schools. You ask us what we want. We want safe schools for the students, safe schools for the teachers and the support staff. And this causes a domino effect. When you don't implement a mask requirement in the schools and you go and get children sick, the children are going to bring that back home to the caregivers and the parents and the grandparents and the daycare providers and the bus drivers. It's going to create more community spread and spread the ailment throughout all sectors of our society and wherever we live at. And so the wisest thing right now would be to have a universal mask requirement as a precursor. It would seem to us some of the logical things to do would be to have periodic COVID testing in the schools. It would be to have some program of social distancing, staggering lunch times, having seating charts. And a lot of groups have spoken out on this. We noticed that last week it was a letter sent out by over 60 education and civil rights agencies. And doctors, the Protect My Care doctors of this state have been speaking. And the TEA has been speaking. And so we think that there are logical solutions on the table right now. The governor needs to take the time, and the state government, we should say the state government, because we're all in this together, should take the time and listen to the advice of the directly impacted people on the ground. And right now, those are the doctors, those are the teachers, those are the parents and caregivers of the students.
So just to put some numbers on this, to back up what you're saying, this is the, I think, top 50 by population counties, and the two in green are Shelby and Davidson County, and this was new cases per 100,000 kids by county a couple of days ago. Shelby and Davidson are the ones that are basically ignoring Governor Lee's opt-out order. So, and they're the ones that are seeing the best results when it comes to cases per 100,000 kids. So, this is working. San Francisco has basically had zero outbreaks, and they have a lot of vaccinated people and kids, and they're wearing masks. There's no secret to why we have the worst outbreak here in Tennessee and the rest of the South. It's because of all this vaccine hesitancy. It's because we're not taking it seriously. It's because leadership is failing us. And so what's your message to people who see over 90% of the people in the hospitals are unvaccinated and still won't get this vaccine, Eric?
Well, it's a lot of reasons why we have vaccine hesitancy. And so you really have to have an ongoing public education program, because I know in a lot of African American communities, it goes back to some of the experiments that were done in slavery. It goes back to Tuskegee. It goes back to a lot of the health disparities that we say that we have ongoing. And also, when you talk about ecological degradation, a lot of areas are built around areas that you have junkyards, or they have factories that have been putting toxins in the air. And so it's also ecological variables. You have a lot of people that haven't been used to having ongoing medical attention. Now that we are saying that you have to put your trust into doctors, where there is mixed messaging everywhere.
Right.
Because we are still studying COVID and learning new things about it every day.
Well, I think that's a great point. Like, I'm an advocate for Medicare for all. And, if you have people who are used to getting treated by a system that's supported by the government, they'd be more inclined to trust something when it comes to help them. But because people are so used to either not having insurance, not having medical care, not having anything paid for, when you give them this free vaccine, suddenly it's like, well, what's this? But this is how it works in the rest of the world, where if you get sick, you see a doctor. In every other country except ours, every other, industrialized country. So
most have free healthcare.
Exactly. That's what I'm saying. So they have free healthcare. So because we don't have that system here, there's a lack of trust in medicine and in the healthcare system in general. So, what we're seeing is we're paying the hefty price right now for not providing healthcare for our citizens in general.
Well, and I know early on, a lot of healthcare advocates was telling a lot of government officials, you have to worry about the social vulnerability index. You have to worry about those people in those most vulnerable populations, the nursing home centers, the prisons, the schools, the jails, the homeless, and the people who don't have health care, and go earn trust. Bring a lot of the resources to them, to those communities, through mobile clinics and mobile testing. It's still not a robust system of testing right now. And we know that with this strain, the Delta strain of COVID, even if you're vaccinated, you might still catch COVID. And so we need a more robust system of testing in the schools and in the communities right now. And so you have to look at those factors, the social vulnerability factors, in order to win the trust of the people, and have somebody that looks like them and speaks like them and understands those communities to actually go in and try to win the trust of the people.
Right. And that is happening in some places in this country. It's just not happening here in Tennessee. And, the messages coming from the top have been very mixed at best. We have Governor Lee, who's going around indoors maskless with kids, even as kids are in hospitals and hospitals are full, posting pictures of himself doing that as though this is the right way to behave. And that's the example that's being set for the rest of the state. So it's no wonder that most of the state isn't taking things seriously. Eric, thanks for joining us. Tell me, how can people get together and join the Poor People's Campaign? I put up the email, Tennessee@poorpeoplescampaign.org, to get involved. How else can they get involved?
Well, before we close, we just want to say that this response, or lack of response, has been irrational, irresponsible, ineffective, and is insufficient and insane. Some of the things that we see coming out of the Department of Education, for instance, we have to do better. And so if you want to join us, they see the website right there, Tennessee@poorpeoplescampaign.org. You can contact us on Facebook and on Twitter. Those are our best areas through social media. And also you can follow us on the national website as well. Because we're making a big push for voting rights now, and also for moral, just COVID relief. And some of these things we're saying are just morally indefensible. And we ask the government, we ask those leaders, meet with the people, meet with the doctors, meet with the teachers, meet with the directly impacted people, and let's come up with a concerted strategy that will have safe schools for students. That's what we want.
Eric, thanks so much for joining us. Appreciate what you do, man. Stay in touch, all right?
Thank you, my friend. We'll talk to you later.
All right, talk to you. So that's Eric Atkins from the Tennessee Poor People's Campaign. I just want to do what I tend to do at the end of these things and address our friend Carlos's talking points here. Just to go through them, I'll start with the most recent one. No such thing as free healthcare, somebody is paying for it. Yes, Carlos, we are aware that to have universal healthcare, we all need to chip in. That's how it works. We know it's not free, but it's something that we should all do to take care of each other. And it's something that the rest of the world has. So I believe that we need universal healthcare, Medicare for all or something like it. And it's something that we do for our children. We have public education where everybody gets public education. Yes, we pay for it, but there's a baseline where we know that we want our kids to be educated so they have access to public schools. We need the same thing for healthcare. That's the same concept. If you want to have private insurance, some people think that should be abolished. I think, okay, pay for private insurance, but you also need to chip in to have universal healthcare and some Medicare for all or something like it. So yes, I know it's not free healthcare, but it is healthcare for everybody. You said the Republicans must be doing something right, supermajority. Well, to me, what they're doing right is feeding you all these talking points that you're swallowing whole, and that is why they have them a supermajority. But if you want to take that logic and apply it to the rest of the country, Democrats are in charge of the Senate, the House, and the White House. So do you think they're doing something right? This really doesn't hold much water here. And then you said, since flu deaths are down because of mask wearing, are you in support of having to wear masks for all eternity? It saves lives, right? If you want to wear a mask, go ahead. You know, if you want to wear a mask forever, go ahead. But for right now, we have a pandemic that is filling up our ICUs with unvaccinated people. Our schools, 27 districts were closed. So we're in a unique situation right now where we all need to do everything we can to keep each other safe. And all of these talking points that you're selling to me and parroting, these are the reasons that we're not making progress. It's because you just are so dug in that no amount of evidence, no amount of data that shows how unvaccinated people are filling up our ICU wards is going to change your mind. If the data comes down and suddenly our hospital is empty and our kids are doing fine, we'll change our mind. We'll say, great, no more masks, fine. But no amount of data could change your mind on this. And so I would ask you, Carlos, you seem to show up here, which to me shows me that you at least are interested to have a dialogue about this. I commend you for that and I appreciate it. I hope you will open your mind to new information and to understand that all we really want to do is keep our kids safe, keep each other safe. And if we have to wear a mask for a little while longer to make that happen so that especially our disabled kids and our medically vulnerable people can move around feeling a little bit more confident that they're not going to die, then we should do that. And I think that's a pretty pro-life position. So I hope you'll consider joining us in it. But I appreciate you being out here. Fauci's data is always changing. It's not Fauci's data, Carlos. It's the data. And yes, the data is changing. That's how data works. And so you need to be able to adjust and take it in and understand that we have a problem, that we have the worst outbreak in the country, maybe the world right now, that we've had the worst outbreak in the country over the course of this entire pandemic. And that is not a coincidence. So I hope that you'll understand that, let that in, and maybe evolve a little bit on this. Thanks for joining us. Follow all the hollers. We'll see you soon.